My name is Joy Williams. I'm 61 years old. I've been living with diabetes for about 20 years and I've been insulin dependent for the past 5. My osteoarthritis developed to the point where I started walking with a cane. I wasn't able to play with my granddaughter. That was really terrible because she's a very important person to me. Somewhere along the line, I had to take a big lifestyle change.
In Eastern Health, we have an aging population and many patients have more than one chronic disease. And in order to support those patients with chronic disease, we have to have innovative solutions to reach them in their community. Access to service is challenging because of the rural geography. Providing service and health services to them where they live is really important.
It's probably the biggest, I would say the biggest innovation going on now in virtual care in a patient's home. You can be anywhere in the province and get the same standard and same level of care. That's one of the big things.
The Remote Patient Monitoring Program is an innovative program that uses technology as an enabler to provide coaching, education, support, and behavior modification, as well as monitoring for patients with chronic disease. Joy really embraced the program. She really embraced the education that she was receiving through the iPad, and she really linked in with her nurse.
Depending on my answers to the questions would be prompt whether I would get a phone call from my nurse.
The program is teaching people how to self-manage their own care, their own disease.
The daily monitoring and teaching you all the skills that you need to better get a handle on your chronic disease is what makes the program so successful. It was really comforting, I guess, to me to know that somebody out there was going to help me through this.
They can recognize symptoms very early, act on them earlier, and prevent an ER visit or an admission, which is a very high cost to the system. It certainly decreases travel for both the patient and the clinician, and it can decrease the number of visits that a patient has to have. Since the implementation of the program, we've seen a 13% reduction in ER visits.
She always used to say Nana has her walking stick, and when I stopped using it, she was so pleased. Nana, she said, you're learning to walk without your stick. So that made me really happy.
The use of digital health solutions is the way of the future if we're focusing in on patient care.